Awareness is key when it comes to gynecologic cancers. We spoke to a local doctor from Intermountain Healthcare, the sponsors of the segment, to learn more on risk factors and prevention.
Hi, I'm Dr. Nika Vizcara. I'm an OBGYN generalist with Intermountain Healthcare in Las Vegas at our Women's Health Clinic. And I'm here to talk about gynecologic cancers today. So when we talk about gynecologic cancers, we're mainly talking about uterine cancer, especially endometrial cancer, ovarian, and cervical cancer. Endometrial cancer is the most common gynecologic cancer in the US, with an estimated 65,000 new diagnoses per year and about 12,000 deaths from this cancer per year. The average age of diagnosis is over the age of 60. Typically it affects postmenopausal women, but with certain risk factors can affect younger women occasionally. So risk factors of endometrial cancer are increasing age, especially postmenopausal, obesity, meaning body mass index of greater than or equal to 30, history of anovulation or not ovulating every month. Some protective factors are, of course, maintaining a healthy lifestyle, BMI, as well as potentially some of the contraceptives, including birth control pills and specifically the hormonal intrauterine device or IUD. Some symptoms of endometrial cancer are specifically postmenopausal bleeding, because any type of bleeding after menopause is abnormal, so definitely let your doctor know about those symptoms, as well as some other non-specific symptoms like pelvic pain, pain with intercourse, or abdominal bloating or swelling. So some risk factors for ovarian cancer are age, with diagnoses rarely happening before the age of 40, family history or genetic predisposition to ovarian cancer, obesity, not having any prior pregnancies in the past, as well as infertility and use of infertility medications for more than a year. Some protective factors for prevention of ovarian cancer are use of birth control pills for at least 5 years, as well as personal history of the removal of fallopian tubes and or ovaries for prior non-cancer indications. And last, we have cervical cancer. So cervical cancer used to be one of the most common gynecologic cancers worldwide. However, with the start of screenings such as the pap smear as well as HPV or human papillomavirus vaccination, that number has decreased. In the United States, there's about 14,000 new diagnoses occurring each year, with the majority being in women between the ages of 35 and 44, and about 4,000 deaths from cervical cancer each year. So some risk factors for cervical cancer, the main one really is human papillomavirus infection, which occurs with skin-to-skin contact, including sexual contact. There are many different strains of HPV, and the lowest risk types cause genital warts, with the high risk types being the ones we are most focused on for cervical cancer, as they are the ones that cause cervical cancer. Other risk factors include not getting your pap screenings or HPV screenings regularly or as directed, and also smoking.
Thank you to Intermountain Healthcare for sponsoring this segment. For more information, head to intermountainhealthcare.org/Nevada. We'll be right back.